Thank you for joining us today at Places for People as we talk about the impact of the coronavirus pandemic on people's well-being and mental health. Clearly, we all know that the coronavirus is a very serious infectious disease that's creating disruption and illness as the human race has not seen in over 100 years. What gets less attention is the coronavirus also has a secondary negative impact on our well-being and our mental health, particularly through stress. And what we want to do is be able to take a little time to be able to look at that and examine the ways that that does create stress, how that might impact your mental health, and then also some ways that you can deal with that in positive coping. We know from a recent survey that a number of people are feeling that stress on their mental health condition. One survey found that about 45% of individuals were experiencing a negative impact on their mental health because of the coronavirus pandemic, and almost 1 in 5 individuals was feeling that was a major negative impact on their mental health. That shouldn't be surprising when we think about the coronavirus is not only an infectious virus, but it's also a major source of stress. And stress, we know, is something that creates difficulties in 3 different ways. One is that stress has a negative effect on our physiology. It puts a strain that elevates our blood pressure and increases the heart rate. It makes for greater muscular tension. It also disrupts other physiological and health systems like our sleep, our sexual functioning. In addition to that, stress is shown to have a negative impact on our mental health and also in our social behavior. Even though the coronavirus is stressful, there's things that you can do about that. One of the first things is just to be able to kind of identify what is the particular stressor or triggers that you may be feeling or people you care about are feeling. And we can identify at first there's some very direct effects by that for people who are infected or who have had the infection. Certainly being sick is a serious stressor. And in addition to that, even far more people are feeling the stress from the pandemic through the fear or the anxiety about, will I be infected? Will my loved ones be infected? And in addition to that, the pandemic has a direct effect on us through trauma. Again, for people who've been sick, particularly seriously sick, or their loved ones or family members, to see someone so sick or in the hospital has a huge negative, stressful effect on them. It also creates trauma for individuals, and at the epicenter of that trauma are people who have had the illness, or their loved ones, or people who are in the front lines, nurses and doctors and other healthcare workers, particularly in the emergency rooms and ICU, who are witnessing the difficulty of this. And all of us can have a certain level of trauma, even if we haven't been directly exposed, of kind of vicarious trauma, maybe of hearing other people, how sick they've been, or even through the media and watching a lot of coverage about the devastating effects of the coronavirus. There's also a number of kind of secondary or radiating stressful impacts, and those can be things like loss of job or various financial impacts for people who've lost their jobs. Certainly it becomes stressful about paying bills or going through their savings, and even for those who still have their job that hasn't been affected. Many people, for example, are seeing their savings, for example, for retirement, to be taking huge negative hits as the stock market is decreased. There's also a lot of social stress that's happening, and that comes as we're asked to do social distancing, that often frays and diminishes our contact with other people. And the flip side of that is even for many of us, it's stressful not to be able to see the people we would normally see at work, or our friends, or our family with gatherings. It's also stressful for some people who are now in their house with a lot of other family members and feeling they don't have the privacy they used to have, and a sense of kind of crowding and not having their own space. It's also difficult in terms of just not being able to do a lot of the things we enjoy doing. There's a certain loss of freedom. Often we can't do the same recreational things we used to do, simple things we would take for granted often, like going to the movies or going out to dinner or listening to music or watching sports or playing sports. All that has really been put on hold because of the pandemic. So there's a number of specific stressors that might be affecting us, and it's good to identify those. And in addition to the specific things like financial, there are really some meta-level stressors that are affecting people. One is, as we've talked about the stressors, a number of those are really, it generates fear. It also creates loss in our life, from being able to go about our normal routines, to do the things we usually do that bring us joy or recreation or meaning, to sadly and tragically for people who are experiencing the loss of loved ones who have died from the illness. In addition, one of the difficult things about this is that humans often find it very stressful to deal with uncertainty, and there's so much uncertainty in this time. Questions like, will I be affected? Will my loved ones be affected? If I am affected, how bad will it be? What will happen to my job? What will happen to my finances? Also the question of how long will it last, and when will we be able to get back to normal? That the coronavirus pandemic can create mental health difficulties, and we can think about that and behavioral health difficulties in at least 4 ways. One is that we know stress can exacerbate existing conditions. And in that way, we know that about 18% of people in the past 12 months have dealt with an anxiety or are dealing with an anxiety disorder. And lifetime, that figure is much higher. About 29% of people have had an anxiety disorder. Stress like this can exacerbate those symptoms. Similarly, in the past 12 months, more than 9% of people have been experiencing a mood disorder like depression, and that the stress can make those symptoms worse. The stress can also create new mental health disorders from stressful situations like the pandemic. It's more likely to see higher rates of anxiety disorders, of depressive disorders, and also of substance abuse. Third, we also can realize that not only does the stress from the pandemic exacerbate existing conditions or create new health disorders, but it can also create mental health symptoms and concerns and distress for people who don't necessarily have their problems rise to the level of a diagnosable mental health disorder, but may still be feeling things like anxiety, increased stress and worry and tension in their lives, or who may be feeling kind of down or irritable or agitated. Those are all kind of normal reactions to stress that can come with the situation that we're living in. People are also experiencing a increased sense of grief and loss. And again, that runs the gamut from the most tragic situations of the loss of life of someone that you know or care about, all the way to the people who are feel like it's a small thing and compared to that, and nonetheless that it's difficult that they aren't able to watch their child play high school sports in their senior year or go to a graduation, or people who are having to cancel weddings or baby showers or have family holiday get-togethers. There's a tremendous amount of loss, and that creates some, again, emotions and grief and a sense of loss that we are all going through and can need to recognize and accept. In addition to that grief and loss, that other feelings like boredom and loneliness are common for some people, as is for some folks who are feeling none of those, but are just feeling kind of a level of numbness, which is also a reaction that happens to stress and to trauma. Finally, we can also see that this level of stress often creates social behavioral problems of things like increased rates of domestic violence, sadly, or child abuse, suicide, divorce rates all increase. The other thing that we know is that symptoms like stressors are likely to vary over time and to go up and down. The other thing that we need to be aware of, and again, this will speak to the importance about coping with that stress in positive ways, is that the stressors and the symptoms can begin to build on each other, can create these downward spirals, which again is all the more reason why we want to try and be able to cope with those stressors and be able to create as healthy, as much wellness and health as possible during this difficult time. We've talked about the number of stressors that the coronavirus pandemic creates for people and some of the mental health difficulties and symptoms that can cause. But the next important question is really, what can you do about it? And fortunately, there's a number of different things you can do about it. One is, depending on the severity of what you're experiencing, there are a lot of community resources for people to help through times of difficulty for mental health and for other behavioral health disorders. In St. Louis, Places for People is one of those agencies. It offers outpatient mental health therapy services as well as substance abuse services and specialized programs for people who have more severe and persistent mental health disorders. There's also a number of wellness or coping strategies that we can undertake. It should be important to note that as we talk about those are meant for educational purposes and not necessarily medical advice. And when in doubt, it's always good to check with a mental health professional.